I want to break this illusion. To swap from smoking to vaping is a healthy alternative, because what the research is showing in just these 5-10 years of studies is that, did you know that vape contains so many unknown chemicals, so many things that we don't even know how to name them or what they cause? If you smoke and vape, then I have really bad news for you. We quadruple the risk of. I'm Dr.Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Before we get started with this super interesting episode today, I would like to thank you for being here with me. I'd like to thank you for sharing these videos and for being part of this content and making comments. I'm enjoying this journey with you, and I really hope this can help you make better decisions. So let's get started. Have you ever wondered what's really happening inside your mouth and body every time you take a puff, whether it's from a cigarette or a vape? What if I told you that the latest research, the latest from 2025, is turning what we thought we knew about vaping and smoking on its head? Welcome back to Mind Your Mouth. I'm your host, Maria Florou, and today we're diving deep into a topic that's on everyone's lips, literally, the real risks and realities of vaping and smoking, using the most up-to-date research from 2024 and 2025. We will explore what this means for your mouth, your lungs, your heart, and even your mental health. Let's make this an interactive conversation. Put on the comments here. Let me know your experience about this topic, or even your friends or anyone in your family that you know that has been vaping or smoking. And I would love to hear from you. What's your view on this, and what the conversation is among your friends and family. Have you or someone that you know switched from smoking to vaping? I personally see a lot of people that thought initially that smoking was really bad, but vaping came with a more natural or less invasive vibe, which is that really real? So that's why I wanted to create this video. Let's break the myth. Let's understand what vaping really is and what are the long-term effects from what we know so far. So drop on the comments. Let's get started with this conversation. First of all, why this debate matters. Let's set the scene here. Cigarette smoking is still one of the leading causes of preventable death worldwide. But here is the twist. Vaping, especially amongst young people, is in the rise. I believe that for some time, we were mistakenly led to believe that vaping was a healthier version of smoking. Recent data, though, shows that cigarette use is dropping, but e-cigarette use is now the most common form of tobacco use among teens and young adults. So here's a question for you. Do you think vaping is safer than smoking? Up to this part of this video or this talk, what are your thoughts before we move ahead? I want to know what your current beliefs are, because my beliefs were that for some time vaping was really better. But let's break it down. Cigarettes contain more than 7,000 chemicals. Dozens are known carcinogens nowadays. They produce tar, which is a sticky byproduct of tobacco, and carbon monoxide, which are deadly for your lungs and heart. But what about vapes? E-cigarettes often contain nicotine, even when labeled nicotine-free. Yeah, that's right. They also have chemicals like formaldehyde, acetone, and heavy metals, and sometimes even antifreeze agents. Yes, you heard that right, antifreeze. A 2024 Irish study found hundreds of potentially toxic compounds in vape liquids, especially in those fruity, candy-like flavors. Many of these chemicals are still unidentified. We don't really know what they are, and let alone the long-term effects of them. Here is a question for you, though. Did you know that vape contains so many unknown chemicals, so many things that we don't even know how to name them or what they cause? It's crazy, but that's a reality. That's something that we see on the studies. Let's get into the science behind this. Smoking, as we know, causes cancer, and nearly every organ, heart, lungs, a lot of organs get affected by cigarettes, and especially the oral health. So it negatively affects immune function and increases inflammation. But vaping isn't off the hook. It's also linked to chronic respiratory symptoms, coughing, and even permanent lung damage. In fact, 2025 research from Johns Hopkins found that exclusive e-cigarette use is also known to cause COPD. COPD is a chronic obstructive pulmonary disease, which means that people with COPD have difficulty breathing permanently. Can you imagine that? And it also found the correlation with increased blood pressure. Also, another interesting fact is that the aerosols from e-cigarettes can cause DNA damage, and it also may contain carcinogens. And if you do both, if you smoke and vape, then I have really bad news for you. We quadruple the risk of lung cancer compared with smoking alone. So both smoking and vaping damage blood vessels and increase cardiovascular risks. So your heart is at risk, and the combination is even worse. And let's not forget mental health. Nicotine is highly addictive and especially harmful to the developing brain. Vaping can actually increase dependence due to higher nicotine concentration in some devices. Now, let's zoom into your mouth. Recent dental research from 2024 and 2025 reveals that both vaping and smoking increase the risk of gum disease, bone loss, and leading to tooth extraction. So people actually lose teeth because of bad choices, and those things are preventable. Vaping alters the oral microbiome. We've spoken about oral microbiome on previous episodes. Go there, check that, because you see the influence that the oral microbiome has in your whole body, your gut, and all the immune response there. So the other thing that we saw in the research is that the sticky aerosols from vape promote biofilm. So it promotes plaque on teeth that facilitate decay forming there. So the bacteria really like that stick plaque that forms after vaping, and bacteria develops a lot faster there. So all in all, what we see is vaping also reduces saliva's protective properties, leading to dry mouth, which increases the risk of cavities, gum disease, and you guessed it right, bad breath. Both habits can cause oromucosal irritation, so then the skin inside the mouth becomes irritated, and even precancerous lesions form. So sometimes we see some wounds that take longer to heal. And if you've got anything that's in your mouth, any ulcer, anything that's there for over 10 days, those ulcers really need to be checked. And if you've got dental implants and you think that your implants are safe because they're not actually your teeth, that's not right. I have bad news for you. The survival rates, the long-term success of implants on people who vape actually drop. So we have not just the risk of losing teeth, but losing the investment that you've made and the treatment that you had taking implants. That's also at risk of being lost there. So let's pause for a second here. Have you noticed any changes in your mouth since you started vaping or even smoking? Maybe more cavities, more dry mouth, more gum issues. Share here on the comments. Let me understand what's happening with you. And we now know what the research is saying, but I want to hear from you what's happening with you here. So I always focus on replying to as many comments as I can. So feel free, put some comments, ask questions. And if I can help you further, I'm here for you. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. Another big topic is dual vaping. What is dual vaping? Dual vaping is when nicotine and cannabis is combined. So a major new review and major new study from 2025, and I just want to make a pause here. You see that I'm mentioning a lot 2025 and 2024, and the reason for that is that when I was doing the research and I was looking at studies from 2017, 2018, the research was saying, oh, vaping is a lot better than smoking. But what happened back then, we didn't have long-term studies. And I can't say to you that we do have long-term studies now, because this is not something that we've been exposed for 40 years. This is something very new. It's new to the body, and we really don't know the long-term effects of vaping. But what we know in the last 5-10 years, it's really significant, and we really should take this into account when we're making the decision of swapping from smoking to cigarettes, or if we want to go cold turkey and stop altogether. And nowadays there's a lot of help for that. So I'm going to talk about this as we go along with this episode. The review has seen that when we combine nicotine and cannabis, we have higher rates of respiratory symptoms, chest pain, and psychiatry disorders. Yeah, you heard me correctly. We have a lot of mental issues on the rise because of the combination of those two chemicals there. And that also happens a lot in flavored e-cigarettes. So I see a lot of people with flavored and fruit flavors, and that gives a false sensation that that is the better option. But as we know, it is not. So vaping associated with lung injury is a serious risk, especially with THC vapes. So look on the label. If there's THC there, please don't use it. This is a risk not just for the person who's smoking, but for anyone who's next to them, anyone who's in constant exposure to the vapors of the vape. And just like with nicotine vapes, dual vaping alters the oral microbiome and increases inflammation, raising the risk for gum disease and dental problems. Here is a question for you. Do you think the risk of vaping cannabis are talked about enough? Have you heard about this before? I would love to hear your thoughts. Now, let's tackle a big question. Does vaping actually help people quit smoking? Some studies show daily e-cigarette use can help smokers quit, nearly doubling quit rates compared with other nicotine replacement therapies. And this is a big but. Due use increases health risks, and vaping is being correlated with very serious health issues so far. The good news is intervention like education, digital tools, and medications can boost the odds of quitting vaping by over 50%. So let's look into ways that are effective, that can help people quit without exposing them to even bigger risks. So even though we see that the research is showing that swapping from smoking to e-cigarettes helps people to stop smoking, in fact, we know now that that needs to be taken with a lot of caution, because we don't want to replace one bad habit for another bad habit. And again, when we look at the short to long-term research on vaping, we know nowadays that it is not a safe alternative. To wrap up here, what I wanted to understand is that the reason that prompted me to do this video for you is that I see a lot of the younger generation. I see a lot of my kids' friends and people between, I would say, even 15 to 30s who think that vaping is actually a good alternative. But what is really important, and that was the goal of this episode, is to help you understand that in fact smoking and vaping are not that different. And what came as a real shock to me to read the research is that we don't know what's in vaping. We can't rely on what the label says. We can't rely on what we know, because when the vaping chemicals are analyzed, we don't know the components that are there. And as I mentioned to you before, we don't know the long-term effects. So I want to break this illusion. To swap from smoking to vaping is a healthy alternative, because what the research is showing in just these 5-10 years of studies is that it is not. And the combination of smoking with vaping, it's even worse because it fourfolds the risk of disease. So remember this, when you're making your educated decision on what to do, ask for help. Ask for professional help with your dentist or your doctor to help you with the tools that are available today to stop those habits. So thank you for watching, and I'll see you on the next episode. So if you're trying to quit, talk to your doctor or dentist. There are more resources than ever to help you or to help the people that you love. So share this content with them, and let's work together to minimize side effects of daily bad choices. I am proud of you for making to the end of this episode. I hope this could help you make better decisions for yourself and for the people that you love. Stay well, stay healthy, and be blessed. I'll see you in the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.